Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande from Pune, Maharashtra State, India, would like to welcome you all in my Ayurveda Academy YouTube channel. My dear friends, today I am going to tell you something about how the doctor examines the patient in general medical practice. This is regarding basic examination of an adult patient. First, the doctor observes the gait, how the patient enters into the clinic. Then he also observes carefully facial expressions, especially whether there is any deformity like, yes, paralysis, or is there any severe anxiety expressed on his face that we observe as the patient walks in our clinic and sits in front of us in the chair or maybe lying down on the examination table. Now, we ask the patient to lie down on the examination table. First, the doctor asks to show the tongue. So we can see basically whether there is any pale or faint color on the tongue, which can indicate the anemic condition. Also, we look for any ulcers on the tongue, which can be like stomatitis. Then, of course, we look for the pallor on the face itself. We can look for the cyanosis, especially tongue. We are talking about tongue. The cyanosis, bluish discoloration at the tip of the tongue, which is called as central cyanosis. And that can be seen when the patient is having deficiency of oxygen. The patient may be suffering from severe attack of bronchial asthma, or the patient may be of emphysema, or there may be some acidosis in the blood. So in the tongue, we observe number 1, pallor, number 2, cyanosis, number 3, aphthous ulcers. Then the doctor asks the patient to say ah. By saying ah, doctor is inspecting the throat, especially whether there is any inflammation, which can indicate pharyngitis. Now, next step, the doctor asks the patient to look down. That means the patient, if he has the specs like me, he has to remove the spec and look down. And when the patient is looking down, the doctor is taking this upper eyelid up or can do like this to examine the conjunctiva. So we want to see the sclera, that is the white portion of the eye, for the icterus. White portion of the eye, sclera, icterus. Icterus indicates the probability of jaundice or infective hepatitis. Then doctor also look for the Bitot spots, a triangular scaly patches on the white of the eye. Bitot spots indicate vitamin A deficiency. Then, as I have told you, the doctor can pull down the lower eyelid and he can check for pallor. Again, like the tongue, the eye pallor also indicates anemic condition, that is, there must be low hemoglobin. The doctor is moving further to examine the patient. Then doctor examining the neck region here. When the patient can be seated position and he can palpate the lymph node in the neck by both the hands. So doctor will palpate the lymph nodes in the neck by the both hands. Next, doctor will inspect the total hands and the palms and especially the nails. That means this is a very fast general examination. Just glimpses. That means if he finds that nail is also having the pale color, it also indicates the anemia or the low hemoglobin. Normal hemoglobin, yes, 12 to 14 gram %. If it is less than 10 gram %, it is mild anemia. If it is less than 7 gram % hemoglobin, moderate anemia. If it is less than 5 gram %, it is a serious, severe anemia. The patient must be admitted in the hospital. So the doctor is examining hands, palms and nails. He is finding the paleness on the nail. And the next important, the structure of the nail. Normally, our nails are convex. But in anemic condition, the nails can be flat. That is called as a platysma. Or nails can be concave. That is called as a, koilonychia. That's right. Now, the doctor will ask the patient to lie down from the sitting position. And then the doctor will observe the toes, feet and the legs for especially edema, because pedal edema most of the times can indicate the problem in the heart, that is CCF, congestive cardiac failure. Here I must repeat you, or I must tell you, in the body there are 3 types of edema. Number 1, here, periorbital edema. Edema around the eyes in the morning indicate kidney problem. If in the abdomen there is edema of the liver or the enlargement of the liver, that is hepatomegaly, simultaneously there may be ascites, so that indicates the liver cirrhosis problem. And just now I have explained about the pedal edema, which indicate your right part of the heart, like right ventricular failure or right ventricular hypertrophy, which can be a part of CCF, congestive cardiac failure. Now, the next step of examination, basic examination of the adult, the doctor asks to semi-flex the legs, because when we semi-flex the legs or fold the legs at the knee joint, our abdomen becomes relaxed. And while examining abdomen, it should be in relaxed condition. Then the doctor will examine the liver on the right side of the ribs, below the ribs, and spleen on the left side of the body. Doctor will check whether there is a hepatomegaly, liver enlargement, which can be a problem like infective hepatitis, that is jaundice, or it may be problems of alcoholic hepatitis or the fatty liver. When the spleen is enlarged, that may indicate the problem in the RBC breakdown, that is hemolytic anemia, or there may be malaria patient where the spleen can be enlarged. Next, the doctor will proceed to auscultate the heart with the stethoscope. At least the apex, parasternal region and the pulmonary area is checked by the doctor with the stethoscope. Doctor will ask the patient to take the deep breath. Inhale, exhale. Inhale, exhale. And doctor will check your lungs for the normal vesicular sounds. For that, doctor will examine the lungs from the front side, from the sideways, and from the back side. So, infraclavicular region, axillary region, and basal regions in both the lungs. So, doctor can check whether your heart sounds are normal, lup, dup, lup, dup, or is there any abnormal heart sounds, which is called as a murmur. For example, lup, dup, lup, dup. This particular sound indicate the murmur, that is abnormal heart sounds. That may be because of the valvular defect. There are valves in the heart in between atria and ventricle, atrioventricular valves. So that may be defective. For example, mitral stenosis or mitral regurgitation. There can be problem in the semilunar valves, aortic valves, or pulmonary valves. So all these things the doctor can do with the examination with the stethoscope. In the lungs, the normal respiratory sound is called as vesicular sound. But if there is a bronchospasm, then the sound is called as a rhonchi. If there is a fluid in the lungs, that can be called as rales. So whenever there cough is there, naturally the doctor will find this abnormal respiratory sounds. Especially when there is a tubercular pleurisy, fluid in the lung cavity, that can give typical pleural rub. Why we do the clinical examination? By doing the clinical examination, the doctor can diagnose as a provisional diagnosis, and that provisional diagnosis can be confirmed, yes, by the investigations. For example, blood examination or the radiological examination, X-ray, X-ray of the chest, X-ray of the back, cervical region, lumbar region, etc. Next examination point is checking of the blood pressure. So this is very important. The normal blood pressure is 120 by 80 mm of Hg. 120 is a systolic and 80 mm of Hg is a diastolic blood pressure. So hypertension is diagnosed clinically, basically, with the help of diastolic blood pressure. If diastolic blood pressure is 80 mm of Hg, normal. If 80 to 90, that is raised, this is mild hypertension. When diastolic blood pressure is 100 to 110 or 90 to 100, that can be moderate blood pressure, hypertension. And above 110 mm of Hg, diastolic blood pressure, it's a severe hypertension. Okay? So, in every patient, it is better to check blood pressure, but especially if the patient is above 40 years of age, if the patient is diabetic, if the patient is known case of hypertension, if the patient is having overweight or the obese, patients with the severe headache, giddiness, or chest pain, all these patients, the doctor should check, or doctor is always checking the blood pressure. So this is the basic examination. This should be done for each and every adult patient, irrespective of his or her complaints. This all together, although I am explaining you for 10-15 minutes, by doing this examination, it requires only maximum 5 minutes. And basically, you must take the proper history. History taking and clinical examination will give you the best idea of the doctor about the provisional diagnosis. So my dear friends, let me tell you, Dr. Deshpande's Ayurveda Academy YouTube channel has lot of interesting videos and especially about clinical examination. Examination of cardiovascular system, examination of nervous system, examination of respiratory system. All these videos are very, very popular. So I request all of you to check all these videos and take the advantage of the knowledge and experience shared by Professor Deshpande. I would like to request you to share and like this video and to please subscribe my YouTube channel to give the boost for my efforts. Thank you very much. Take care and see you in the next video. Thank you very much.